Okay, it's connected. Perfect. Okay,
Awesome.
let's go ahead and get started, guys. Sorry about that. So my name is Alex. I am the Director of Marketing here at Paloma Health. In case you don't know who we are an online medical practice that specializes in hypothyroidism and Hashimoto's. We have so many different resources available, blogs, we have recipes, we have our free mobile app, which you can download on iOS and Android, and you can like symptom track, you can order test kits, you have your labs uploaded. But what's really great, obviously, about us as a medical practice, you can see providers like Dr. Goggin here. And from the comfort of your own home, we're a virtual medical practice, so everything is done virtually. Again, our test kits can be sent to you. Just drop them off at post office and then return them and get your labs in about a week. So without further ado, I'm going to go ahead and pass it off to Dr. Goggin. Just a heads up, we won't be able to get through all of the questions. We had an influx of questions for this event, so if we miss your question, I am so sorry. We'll definitely try to get to it next time. However, we do have another event every month. So if you want to ask your question then, you're more than welcome. So without further ado, I'm going to go ahead and pass it off to Dr. Goggin. She's going to introduce herself and we'll get started.
All right. Thank you so much, Alex. Hi, guys. I'm Dr. G. I've been a family doctor for more than 20 years. And what happened was I got sick. And then I went into holistic and integrative medicine because I had to figure out how to get myself better. And my passion right now is for helping people get that thyroid care that they deserve. And so Alex didn't mention this, but all of the physicians at Paloma are really going to look at the whole person and do what we call integrative holistic thyroid care. And so we believe in full thyroid panels. Many people ask us, do you check more than a TSH? 100% of us check more than a TSH. And we really want to find that balance of your symptoms and labs so that you feel better. So let's dive into the questions. And I'll try and answer as many as I can. Okay. All right. So, okay, this is fascinating. Thoughts on black cumin seed to reduce antibodies and inflammation. Guys, black cumin is something that's been used like in ancient times to help with inflammation. It's an antioxidant. It has immunomodulatory properties. And there even was a study looking at people with Hashimoto's for 8 weeks and looking how black cumin seed could help. Within that, they actually found significant reductions in body weight, body mass index. And so there are probably a lot of things that are happening when we use black cumin seed oil in order to help the body. But the primary one is that it's going to lower inflammation. So I think that it's something that is probably generally recognized as safe, could be helpful. You want to make sure you're checking a full thyroid panel before, and also tracking your symptoms. And based on the one article that I found on this topic, track your body mass index and your weight and see how those things shift over time. But it might be something worth trying. It's been called a miracle herb. So that is a great question, and it makes me want to go get me some black cumin seed. Okay, so next question. I got to look around my camera. What's a good vitamin D level? Well, when I check someone's vitamin D, my first thought is that the level that comes out from the lab could be 10 points above or 10 points below. So there's like a margin of error. And so I personally feel like I want to see people in the upper half, basically, of normal. And me, I'm kind of shooting for 50 to 80. That's my preference. I believe that there's some great research that tells us that vitamin D deficiency affects so many systems negatively. Of course, can feed into autoimmunity. It also will reduce your ability to, fend off from illnesses and viruses and so many other things. So I'm shooting for 50 to 80 with my clients. And I will say that I have seen people, you don't know how much vitamin D it's going to take to get you into a good range. Some people can take 1,000 international units a day and get into a great range. Other people have genetic polymorphisms, little genetic uniqueness that makes it harder for them to get to those good levels. And for those people, sometimes they need 5,000, 10,000, 25,000, sometimes even more in order to get into the optimal range. So you got to be checking, right? So you can see if you've gotten into the optimal range. All right, next question. Very interested in natural desiccated thyroid or armor thyroid instead of levothyroxine and liothyronine. Why are doctors so hesitant to prescribe natural thyroid products? That's a great question. And it comes from the historical treatment of both the historical treatment of thyroid problems, which we all know is fraught with some basic problems. Historically, we were taught in medical school that all you need to do is give T4, and the body should turn the T4 into T3. So we don't even need to check those other labs. That's what we were taught in medical school. Just check the TSH and then use that to get that into range. And so most physicians, at least in conventional training, we're not taught to use even T3 and T4. So a physician who steps away from just using T4, which is Synthroid or levothyroxine, Levoxyl, all those are the inactive T4. So a physician who steps into using a little bit of Cytomel or T3 is already kind of stretching that conventional envelope. The armor and the NP thyroid, which I find many people respond great to, it's just not adequately taught in medical schools. And I believe there's, could we call it a smear campaign from the people that make the T4 to say that these are not standardized. And so since that time, and you probably have heard that things like NP or WP thyroid, they have been taken off the market intermittently, like if a batch was tested and they weren't standardized. And so this is something we want to make sure that when we give somebody medication, it's got the right stuff in it. And so now all of these companies are really making an effort to make sure that what they say is in the medication is what's in the medication. And so that's where the concern lies in physicians who haven't had experience using NP thyroid. And the other big thing about NP thyroid and armor thyroid, they have a ratio of 80% T4 to 20% T3. All right. And then when we give Levoxyl and the Cytomel or something like that, probably your natural level, you and me, our natural level is somewhere in between 100% T4 and the 80-20, right? So it's a matter of how do we find that place for you? Sometimes I use a mix of Levoxyl and NP thyroid to get that sweet spot. But the reason doctors aren't really trained in it, they're a little scared of it. They're scared of litigation. So all the reasons that doctors might not do that. But if you get used to using it and you find that somebody feels better with it, I think it can be, it's such an epiphany for a physician. And so any physicians watching, Rethinking Hypothyroidism, a great book that all y'all should read if you aren't comfortable with using T3, because it can change people's lives. Okay, next, can low ferritin levels replicate thyroid imbalance symptoms? This is a great question. And in fact, yes, and there are multiple other things that can look like hypothyroidism. Specifically, I think of toxicities that can make people feel totally crummy and make people check off all the hypothyroidism boxes. So they would think, oh, this must be an issue for me. And one of those is certainly iron deficiency. And we talk about low ferritin levels. That's related to when it's related to iron deficiency, and especially if you get an anemia due to iron deficiency, that can look a lot like hypothyroidism, and the two can go hand in hand. So that's one of the reasons that we will check iron levels commonly to make sure that's not part of what's contributing to hypothyroidism and to fatigue. So I think that is very good to make sure you know your iron levels. Ferritin is storage iron. So when your doctor checks iron levels, I believe that they should check not just storage iron, but also your actual iron levels. I think that's important. Ferritin on its own can go way up when we have inflammation. So if we get an infection or we have a big stress on the body, the ferritin level can go sky high and make you think you've got enough iron when in fact maybe you don't. So it's because it's called an acute phase reactant. Okay, so how are we doing so far? We're going through these. What are my thoughts on red light therapy for the thyroid? Yeah, if you know me at all, I am a big fan of energetic medicine. And I think one day it will be true. Every family doctor will be prescribing different types of light for people. I did a quick search to see if there's anything specifically around red light for thyroid, and I couldn't find research based on just on that. However, we know that red light therapy can be beneficial in fatigue. It can be beneficial in cognition. And what are some of the big things that we see that are problems with hypothyroidism? Fatigue, brain fog. We also know that when you apply a red light to one spot on the body, you get a full body effect. So when you apply a light to the tummy, you're going to get a shift in the microbiome. And since you guys probably are aware, if you're here, that hypothyroidism is most commonly caused by Hashimoto's hypothyroidism, which is an autoimmune problem that is likely linked to gut issues. So I was about to say, so if you shine a red light on your gut, some people think that it may be affecting the microbiome, and that's why we see a huge positive effect across the whole body. So I would say yes to trying a little red light therapy, but thinking of it as a wellness thing. And if you get more energy, start to go out and get more walks, get a little more exercise. All those things that are going to help you feel better. Okay. The hypothyroidism and hypoglycemia. Okay, here's a question. I'd like to hear more about the link between low thyroid and low sugars. Well, if your metabolism is down and your cells are not from low thyroid and your cells are not working really well, it's possible that when you give yourself a bolus of insulin from your pancreas, that your level of sugar in your blood can go very low and can make you very tired, make you sleepy. The big thing, though, when I think of low sugar, is trying to get the whole metabolic system right, and it is a complicated web between your adrenals and your thyroid and your gut and your insulin. So all of these are there's so much interplay there. It's hard to say exactly how this will affect from person to person. So I do think, I'm a fan of getting more data on ourselves. And I think that if somebody, especially if somebody's trying to release weight, getting a continuous blood glucose monitor, you can get them these days without having diabetes, to see what's happening with your sugar in relation to food intake. So this is something that you can actually get a free 2-week trial from, like Freestyle Libre and Dexcom. All you need to do is get your doctor to write a prescription for a trial. And then these are things that you put on the back of your arm, and you could take your cell phone and you can wave it over the device and you could see exactly what your level is. And it's important, if you're going to do this, you want to be able to keep track of what I ate, what did I have for lunch, what happened to my sugar afterwards, so you could begin to tweak your nutritional intake and use the data. So if you aren't ready to use the data and track, it's not worth it. But I do think that it is, if you're into biohacking or into collecting more data to help your body thrive, it can be so revealing. Like I had a patient who she's like, I could not eat blueberries. Blueberries made her spike, made her glucose go so high and then drop so low. Whereas she was like, but it didn't do that when I ate cheesecake. So everybody's body is different, and it can give you more information on how to utilize foods therapeutically. The other thing I'd say is that if you're going to ever get a CGM, you want to play with fiber at the beginning of the meal, because guys, fiber at the beginning of the meal can blunt that sugar like big old boost and then fall. So fiber and protein at the beginning of the meal, save those carbs for the end of the meal for sure. All right. Oh, this is interesting. Now this is the one I read. I'm like, I'm not sure, but I do have some thoughts on this regarding weight loss resistance. Is liposuction a realistic long-term solution for removing fat for thyroid patients? Does any type of surgery pose a risk of hypothyroid flare-ups or worsening of the condition itself? Okay. Well, if we, like most of us think, it kind of depends first on why do we have hypothyroidism. If you have Hashimoto's, that means you have had antibodies. We call that an inflammatory condition. If you have hypothyroidism because of the like surgical loss of the thyroid and you're just getting replaced and you didn't have antibodies or anything, then it might not be so much of an issue that but anytime you have a procedure that causes inflammation in the body, it can definitely rile up the symptoms and the antibodies of Hashimoto's. And so then the question becomes, what's the best way to help people release weight? Would liposuction be a long-term thing that would be helpful? If liposuction were something that could be a very long-term benefit, I think you would see more bariatric specialists using it. When I did a quick search on this, long-term effects, and I'm not, I want you guys to tell me if you know something I don't know, but I wasn't finding a lot of, I found zero, like the positive long-term effects of liposuction. It made me think that on that quick search that perhaps that's because the long-term effects aren't really there, that people are able to keep it off when you don't change other things, right? If we go and do some liposuction, the other thing I feel slightly concerned about is that when they remove the fat, they're removing the type of fat that is less inflammatory. Okay, so like our muffin top fat is not that internal fat that causes more inflammation. And I have a hunch that if you are taking away that external fat, that it could possibly lead to some metabolic problems, because you would have more of a tendency to increase the fat internally, which is more inflammatory. So if I was going to advise somebody on what is a weight loss solution that seems to be very helpful, I'm not a big meds prescriber, y'all. I have to tell you. I mean, I really am limited on. I try not to prescribe Band-Aid medications for things. That's my feeling. I've seen so many people do well though with GLP-1 inhibitors. And I've even seen people do well with a subtherapeutic, a super low dose. That if it was me and I was trying to think about, well, I have weight loss resistance, if there's any kind of sugar issue at all, I would probably be looking at, before liposuction, GLP-1 inhibitors, and making sure that that the style of eating is shifting as I'm doing that. It does no good if you go and do something like lipolysis or GLP-1 inhibitor, and you continue to eat what we call the SAD, the standard American diet. Standard American diet, you will gain the weight back. The lipolysis won't do anything. So focusing on lowering the inflammation and getting people onto a style of eating that which is generally speaking, the AIP is great. Even a modified Mediterranean diet can be good. That I would probably be pointing somebody more towards a trial of a GLP-1 inhibitor, especially if they had glucose issues. Oh, and then here's a really, really good question. The connection between SIBO and Hashimoto's. SIBO is small intestinal bacterial overgrowth. And basically, it's a dysbiosis. In your tummy, those microbes are having overgrowth of certain colonies that will cause inflammation and can cause leakiness. And so that's the big problem, is when our gut, which should be a nice tube that keeps the food where it's supposed to be, it doesn't let big pieces of food through. When that happens and we have leaky gut, right there on the other side of our bowel wall, all of our immune system basically is waiting to see if it's friend or foe. And this is how, if we get these big particles coming through the bowel wall and the immune system sees those large particles and maybe they look a little like your thyroid, it will make antibodies to your thyroid. And so that's why closing out the leaky gut, making SIBO go away, getting you to gut nirvana is a very important step to getting you to thyroid nirvana. So, I mean, I think that's I have a patient now, so I'm going to have to go see him. I think that's the last one I can answer. But is it possible for not? Yeah, I think I'm going to have to leave it off there because I've got a patient now. Did I get through a lot of them?
Yes, thank you so much, Dr. Goggin. Guys, thank you so much for joining our office hours. I apologize we didn't get to all of your questions. We do have office hours events that we've done in the past. If you want to go ahead and rewatch those, they're all on our YouTube channel, or just go ahead in the community, go to past events. You could check them all out there. If you would like to book an appointment with Dr. Goggin and see her as a provider, you could go to the Paloma Health website, and if she's available in your state, you can book an appointment with her as soon as possible. Again, thank you guys so much for joining. We'll see you next time. Be sure to join us on Instagram and our newsletter, and you'll be updated with more